Did you say? Good morning. My name is Renee. I'm going to be the nurse taking care of you today. I'm here to do a head-to-toe assessment. Before we get started, I want to make sure that I close the door and pull the curtain to provide patient privacy, to make sure that there's no privacy issues going on here. I also want to make sure that I have the bed in the lowest wheels locked position to provide patient safety. And before I tell you a little bit about the head to toe, I just want to make sure I have the correct patient. Can you verify for me the name and date of birth?
Madison McCollum, 6/4/11.
Great, thank you, Madison. Okay, so I'm going to be performing a head to toe assessment on you. And basically what that entails is I'm going to kind of give you a look over from top to bottom. I'm going to be checking out your head, looking at your eyes, checking your mouth, looking at some perfusion in your nails, and checking pulses, checking your heart sounds and lung sounds, looking over your belly, and checking your skin as well, okay? Did you have any questions about that so far?
No.
Okay. Do you know where you are?
No.
And do you know what you're here to do today?
Check.
Okay, all right, great. So off of my first assessment, I would say that doing a quick assessment, patient is maintaining proper eye contact, patient has appropriate affect, hygiene is appropriate, patient is clean and dressed appropriately for being in the hospital. Patient is having spontaneous eye movement and answering commands, sitting and handing me your hand as appropriately. So I would say, as far as the Glasgow Coma scale, the patient would be rating at a 15 with that. So I just have a few questions before we get started. Wanted to check and see how you've been sleeping. How do you sleep normally, and how you've been sleeping since you've been in the hospital?
I've been sleeping good.
You've been sleeping good? Okay, that's good. Do you typically take anything to help you sleep? Any medications over the counter?
No.
No? Okay, great. And so how have you been eating? Do you think you've been eating more since you've been in the hospital, or a little bit less since you've been in the hospital, or about the same?
About the same.
About the same? Okay. If you had to put a number on the amount that you've been eating when they bring you your trays, for example, 25%, 50%, 100%, if you could give yourself a number on how much you're eating when they bring you your trays, about how much do you think you're taking in?
So.
About 75%? Okay, that's good. That's not bad at all. So I want to just go ahead and assess a few other things. I didn't see an allergy band on, but I just want to verify, do you have any allergies?
Not that I know.
Not that you know of. Okay, any allergies to any medications or foods?
No.
No? Okay, great. If the patient stated that they had any allergies to any medications or foods, I would double check that we have that information appropriate in the patient's MAR in the system, and make sure. I would also follow up with what happens when the patient interacts with that specific medication or food. What is the reaction, and what they typically take, whether it would be an EpiPen or any Benadryl or anything like that. I would get that information, make sure it's in the system, as well as make sure the patient has an armband on as well. Great, so no allergies, Madison. Also want to start with a quick set of baseline vitals. So that just means I want to get your blood pressure, and I want to check your respirations and oxygen level. And so what I would typically do at this time would be to hook you up to the blood pressure monitor and take a blood pressure on you. And I believe that your blood pressure is 118/78. So a 118/78 indicates a normal blood pressure. If we had a systolic of 120 to 129 and a diastolic of 80, that would indicate an elevated blood pressure. So we would look for those ranges. I would also put on a pulse ox monitor, and I feel like if we had anything under 95%, I would go ahead and ask you to take a few deep breaths to get some oxygen in and open up those lungs and wait for that number to rise. But I say that we put an oxygen O2 monitor on, and I say 97% is good. That's good for room air. But we like 98% and 99%. But I would take a look at your respirations by counting the rise and fall of the chest, and I would, in 15 seconds, see 4 Times that times 4, I have a respiration rate of 16, which is within normal ranges. A heart rate on the monitor of 80, and that is also within normal ranges. And then I would do a temperature check, maybe a temporal check of 97.9, which is a temperature within normal limits as well. The fifth vital sign, of course, would be pain. So I want to ask you, do you have any pain today?
No.
No, perfect. If the patient states they have any pain at this time, I would ask where the pain was. Does the pain stay in one spot? Does it radiate? Does it get worse or better with anything? I would ask if the patient takes anything to help alleviate the pain. How many days did the patient have the pain? So I would do more of a focus assessment at that time and then revert back to my head to toe. But our patient says she has no pain, so we could go ahead and move forward with that. While I'm right here, Madison, I'm going to take my pen light. I grab that. And I'm going to shine a light into your eyes. But before I do that, I want to make sure that you're looking right at my forehead, okay? Don't look at the light. It's just going to be a brief moment. Great. So what I'm looking for is to make sure that our pupils, your pupils are equal, round, and reactive to light. And I do see that by when I shine the light in there. So your pupils, I do not see any signs of meiosis, which would be small fixed pupils. If I saw maybe on your chart that you had a history of cataracts, then I wouldn't expect any accommodation or any reacting with the light at that point. But your pupils are round and reacting there, so we look good there. While I have my light, I'm gonna go ahead and take a peek inside your mouth. Can you open up and say ah for me? Great. Pink and moist. No dentures noted. Original teeth intact. I'm gonna take a look at your nose as well. Nose is patent. While I'm here, I'm gonna go ahead and just take a quick look at your head. Thank you. It's round, smooth, hair is clean, no signs of dandruff, no signs of lice. I'm gonna go ahead and check our temporal pulses. They are equal and bounding. I'm gonna go ahead and check your carotid pulses one at a time. Great. Great. The reason we check those pulses one at a time is because we do not want to induce a vagal response by cutting off the oxygen supply to your brain by checking both at one time. So we check them one at a time. Awesome. While I am checking we're just going to kind of move down here. I'm going to go ahead and check your brachial pulse. Strong and bounding, equal. Your radial pulse. Great. And I'm going to go ahead and check this side as well. And you can go ahead and relax the arm. And I'm going to have you squeeze the hands for me. Great, while I'm there. Perfect. So your pulses are equal and bounding on both sides. Face is midline, erect, midline, and appropriate to the neck. And so what I'm going to do now is go ahead and take a listen to your heart sounds, okay? So I'm going to start by listening to the aortic valve on the right sternal border, second intercostal space, and I hear that S1 sound is louder than the S2. I'm going to move over to the left sternal border, second intercostal space, listening to your pulmonic valve. S2 is louder than S1. I'm going to go down to the third intercostal space, left sternal border, where I listen to the Erb's point. Fifth intercostal space, left sternal border. where I would be listening to the tricuspid valve. And then with the back of my hand, I will move the breast tissue up and listen at the fifth intercostal space to the mid clavicular line to the mitral valve. All heart sounds are sounding clear there. And then I will go ahead and start to listen to the lung sounds. Anteriorly, I would be listening to 12 sounds, and I would also listen to the lower right lobe, the third lobe on the right side. And so I would be listening in a Z pattern or an H pattern anteriorly to your lung sounds. And I'll just have you start by taking a deep breath for me. And then I would go around here. Great. While I'm here listening, lung sounds are clear. I don't hear any sounds of wheezing, and there's no diminished sounds in that lower lobe on that right side.